So like we have talked about few diseases, diabetes, hypertension, COVID, asthma. To summarize, if you were to ask somebody of common drugs that are you on these drugs and then tell them you cannot donate, insulin has clearly come out as one drug which you cannot donate if you are taking insulin. What are the other few medications which people commonly use? If they are on that, they cannot donate.
They can be taking antibiotics for sore throat. They can be taking antibiotics because they had a local infection. So if they're on an antibiotic, so they cannot donate for 2 weeks. Also, another drug is insulin and oral these things. For women who are taking oral contraceptives, they can very well go ahead and donate blood. There are no evidence telling that they cannot really donate blood because it alters their blood. There's nothing like that. If they are on OCPs, they can go ahead and donate blood. They're also, if they're taking some sort of analgesics for migraine, but it's like not like a regular migraine. They don't have the severe attack of migraines. But if they are taken a paracetamol the previous day, if they're on analgesics the day of donation, we can very well go on and accept them for donation. And yeah, even if they're on any vitamins and something like that, they can very well go on and donate blood. If they're hyper so if their cholesterol levels are high and if they're taking medications to bring down their cholesterol, we can go and donate blood. Just because they're taking something to bring down the lipidemia, so doesn't mean we shouldn't let them donate. So that's another thing we should ask for. The donors should know if they're taking atorvastatin or any of these anti-hypertriglyceridemia drugs. So usually these are the drugs which we ask for. The other thing is, most importantly, make sure the donors are know if they're having a heart disease, if they're having a heart disease or a heart condition, and if they're taking any medication for previously they had a heart attack, myocardial infarction, or heart failure, or angina. So any of these heart problems if they have, and if they're taking medications for their heart problems, they really cannot donate blood because they need the blood. One thing is like, no, they need to maintain a state of good volume in their body. Their volume cannot just like fluctuate immediately, because you're removing 450 ml of their body, the heart starts pumping a little faster to make sure that their cardiac output is sufficient. The cardiac output in the sense the amount of blood they're actually pumping inside the blood is sufficient. So we don't want them to go through a stressful situation for their heart. So people on cardiac drugs, people on having any cardiac problems, make sure they're not taken for blood donation. That's the most important thing which I would like to emphasize here.
So just to summarize what you and Joyce, both of you have mentioned, is somebody with a controlled diabetes, controlled hypertension, with no damage to heart, no damage to kidney, can donate blood. Somebody with hypothyroidism can donate. Females on OCP can donate. Hypercholesterol on statins, they can donate. So that's something which we have covered so far. And the vaccine, you have to wait for, I think you said 2 weeks.
Yes.
And what about some other vaccine? Like if I get a cut and I take a TT shot, which is very common in adults, how long should I wait then?
For a TT injection, you'll have to wait for 2 weeks again. So we should also know what vaccine they had put. So if they're taking a live vaccine, so for example, live vaccine in the sense like if they're taken a shot for hepatitis A, or if they've taken something for measles or polio live vaccine. So at that point of time, they'll have to wait for 28 days, so close to a month before they can donate blood. And when it comes to non-live vaccines such as like tetanus toxoid, etc., they'll have to be deferred for 2 weeks at that point of time. For rabies, so if they had a dog bite and they've taken anti-rabies vaccination, they'll have to wait for 1 year before they can donate blood.
I think the only other disease I'm not sure they mentioned was people on antipsychotics or psychiatric medication also. I think that's a permanent deferral for them.